Hello, everyone, and welcome to today's virtual panel discussion brought to you by the Georgia Association of Healthcare Executives. My name is Ricardo Rivera, and I will be your session host representing the National Office of the American College of Healthcare Executives. Before we get started, I'd like to go over a few items to help you navigate the program in our virtual environment. For the purposes of noise control, your lines will be muted for the duration of the session unless there is an active discussion, at which point you may unmute yourself to talk. You can submit questions through the chat function at any time. This event is being recorded and will be available for viewing in the ACHE Learning Management System in approximately 2 business days. Today's session is worth 1.5 hours of ACHE face-to-face education credit. To earn this credit, you must be logged in for the entire 90 minutes of this event. All attendees who meet this requirement will have their 1.5 face-to-face credits applied within 2 weeks from today's event. We do encourage you to complete the evaluation for this event. The evaluation link will be posted in the chat box soon, so please visit the link before we close out today's session. Now, to begin the session, it's my pleasure to introduce and turn it over to GAHE President Trent Lind, CEO of Eastside Medical Center.
Thank you, Ricardo, and thank you for everyone who's joining us today. A tremendous topic. Georgia Association of Healthcare Executives has tried our best to put a lot of good topics on the calendar, especially throughout our virtual time together over this past year. And it's exciting to be able to talk about successes that have happened throughout our pandemic. And the topic here, sustainability of healthcare organizations, a roadmap to performance excellence, and certainly a topic that we all strive to achieve. And even when we face barriers such as we did last year, again, to see colleagues of mine that are part of the panel today and the successes they've had, it really just is great to see. But we can't get started without taking a few moments to recognize our sponsors. And GAHE doesn't have the ability to put on events like this if it's not for tremendous sponsors. And our platinum sponsor want to give great recognition to Wellstar for all they do to help support GAHE. And then for our other sponsors, our gold level sponsors, Cancer Treatment Centers of America, Sound Physicians, Metro Atlanta Ambulance Services, Beck, Protivity, Phillips, and HCA TriStar Division. And then for our silver sponsors, DT Spade, KCA Firm, SSR, and Nagel and Associates. Again, thank you so much for all you do to help us with your support to put these events on. Some upcoming virtual events. We're very excited to share with you a couple of events that are on the horizon. The first on May 24th, the GAHE Leadership Series webinar with Keith Parrott. He's the president and CEO at Amita Health, and really a tremendous topic around integrating cultures post-merger. I've had the chance to connect not directly with Keith, but with some of his counterparts and learn more about this topic, and it really will be a tremendous session. And then shortly thereafter, on June 1st, we've got Michael Mayo. Mike Mayo is the president of Baptist Medical Center in Jacksonville. I actually had the privilege of working with Michael years ago, and really excited to hear him talk about a topic that's also very important, which is building high-performing teams. So please register. You can register at www.gahe.org. And then stay connected. We do so much in the world of communications to get our message out, and special kudos go to Seppi Browning, who helps to lead our efforts around our communications effort. Obviously, we talked about www.gahe.org. Also, make sure you stay connected to us via Facebook, LinkedIn, and also Twitter. And please get involved. I know we have a lot of members that join us for these sessions, but maybe don't get as involved as they desire to. And there's a lot of different avenues you can see here through our various committees, including Communications Committee, Career Development Committee, Fellowship Advancement Committee, Membership Growth and Satisfaction, Physician Executive Group, Programs, Sponsors, and then last but not least, our newest committee, Diversity and Inclusion. So if you're interested, please reach out. Bruce Lloyd, our administrator of GAHE, can be reached at admin@gahe.org. And as Ricardo mentioned, please make sure that you go on to ache.org today and get credit for these hours that you're attaining. It's 1.5 hours of face-to-face credit, so a great opportunity. So last but not least, let's jump into our agenda. This is what we've all been waiting for. Sustainability of healthcare organizations, a roadmap to performance excellence. And again, as I mentioned, really proud to have a chance to present to you not only our moderator, but our distinguished list of panelists that will be part of today's session. But let me start with introducing Rebecca Rule. She will moderate today's event. You can see a lot of acronyms behind Rebecca's name. She certainly not only has the background, but the accolades to go behind that. And let me share a little bit about Rebecca. She's currently the Vice President of Compliance Operations with Wellstar Health System. She is responsible for developing and executing the regional compliance support model for Wellstar Health System and coordinates the efforts of the system's regional compliance officers to ensure that each of the 11 hospitals, outpatient facilities, and associated physician practices operationalize the compliance program, plans, policies, procedures. She's also serving as an interim leader for a role for the Employee Health Services, managing the day-to-day operations and COVID vaccination process for the system's 33,000+ employees and affiliated providers. Rebecca has been a national Baldrige examiner since 2001, has served as a site visit team leader for multiple years, assisting the development of the Master Examiner Initial Training Curriculum, and served as the role of instructor for all those eligible to receive the designation. Rebecca is recognized as a Master Examiner and is frequently tapped to provide education to leaders and staff across the industry and country on the process and benefits of the Baldrige framework. Welcome, Rebecca. Thank you so much for taking your time out of your afternoon, and appreciate you moderating this amazing group of panelists, and I will turn it over to you. And Rebecca, you're still muted. Sorry.
Can you hear me? Awesome. Okay. Thank you, everyone. You can tell right off the bat that not part of my bio, IT will never be there for me. That is definitely not a skill set. I want to take a few minutes to thank everyone for joining in this program today. I think you're going to find that there's a number of individuals at your fingertips who you can reach out to really at any moment to garner additional information on both of the programs that we're going to be talking about. So as you are all aware, we're going to be taking a look at those items that help to support the sustainability of healthcare organizations and to really drive performance improvement across multiple organizations. Next slide, please. So I'd like to introduce to you our panel today, and I'm going to start with John Kuban, who is Senior Vice President and President for one of the facilities, and actually has kind of a dual role going on right now for Wellstar Health System. But John has specialized in healthcare management, strategic planning, performance improvement, and utilization management, and has been with Wellstar since March of 2018. He has been instrumental in driving organizational improvement and has achieved an A rating for Paulding with Leapfrog and a 5-star CMS rating. The facility has been awarded the Georgia Oglethorpe Award and has the first and only hospital in Georgia to receive the Baldrige State Award. So, a long history there, although in a short time frame, a lot has been accomplished. He came from Memorial Hermann as the COO out of Texas and has helped drive the culture there, focused on patient safety, making sure that they achieved a top decile performance and the Texas Award for Performance Excellence and the Texas State Baldrige Award, as well as facilitating $120 million expansion. John received his master's degree in healthcare administration management and an MBA in business from the University of Alabama at Birmingham and a bachelor's of business. Hold on, I got to move this. A bachelor's of business degree from Millsap College, and an associate's degree of nursing from the local community college. I will say I've had the opportunity to see John serve in a nursing role through the COVID vaccination process, and I was eminently grateful for the participation that he had from a nursing perspective in that initiative. He's a fellow in the American College of Healthcare Executives and really drives the opportunity for professional growth and advancement in his team. Next on the panel is, got to move sorry, again, I got to move over to this, is Dion Geiger, who's the president of the Florida Sterling Council. She has served as the executive director for the last 26 years and is one of the founding members for the Florida Sterling Council. The Sterling Council itself is a not-for-profit public-private organization whose mission is to elevate organizational performance excellence. I want to particularly call out the Florida Sterling Council, who has been instrumental in supporting and driving the opportunities, not just in Florida, but also in Georgia, as organizations move towards performance excellence and the opportunity to be recognized for such. As president, Ms. Geiger is responsible for promoting, marketing, and ensuring the integrity of the award. And as part of the award process, she's responsible for planning and management of the annual 4-day conference and Governor's Award banquet held in Orlando each year. The council also offers extensive training in many areas, including Six Sigma, and has now started its 27th award cycle. The Governor Sterling Award was established as to identify premier statewide awards and to drive that portion towards the national opportunities that are there to recognize true excellence. She's earned her graduate and undergraduate degrees from the University of Florida and specializing in political science, and has a certificate in public administration. Our final panelist today is Dina Gilliard, who is the Vice President of Patient Services and the Chief Nursing Officer of Emory Healthcare's ambulatory practice, and is an instructor at the Nell Hodges Woodruff School of Nursing at Emory University. She has dedicated the past decade to establishing a national model and structure for nursing practice in an ambulatory care setting. Her work centers on nursing optimization and illuminating the value of nursing itself as a profession. She has impacted nursing practice by developing an ambulatory nursing organizational structure with senior nursing leadership, optimizing the ability of nurses to impact the health of our population, including a document submission as part of the journey towards Magnet's inaugural designation for a completely ambulatory facility. She received her doctorate of nursing practice in health system leadership and her MSN in healthcare leadership from the Emory School of Nursing and her BSN from Georgia College. She's completed the Managing Healthcare Delivery program at Harvard Business School and is a fellow in the American Academy of Nursing. She currently serves as on the board of directors as the president-elect for the American Academy of Ambulatory Nursing. I want to make a special call out to all of the panelists to not only thank them for their time, but to also emphasize the expertise that is available to us through this session by virtue of their experiences, education, and focus on excellence. Next slide. Just in order to level set for all participants here, I want to make sure that we're clear about the different programs that we'll be talking about and the challenges that each may have as you move towards your own journey to excellence, if you're not already on that road. Keep in mind, please, that the first one relates to magnet designation, which Dina will help us gain a greater understanding of throughout this program, but it really focuses on the global issues in nursing and healthcare and how those particular components integrate to create a true model of excellence, from structural empowerment, the professional practice itself for nursing, the ability to garner new knowledge, develop and identify innovations and improvements that may pose true opportunities to advance any organization, and the guiding light of transformational leadership that helps and supports drive this. Obviously, for both programs, the empirical outcomes are integral to being able to demonstrate to others the true leadership capability and opportunities that come from taking on a journey either of Magnet or Baldrige. So the second graphic there is demonstrating or illustrating the Baldrige program itself, keeping in mind that this encompasses the entire organization, taking a look from the leadership as it flows through the strategy, the focus on customers, emphasizing the workforce as a whole, the operational model that then drives the outcomes. It is truly focused on looking at core values and the concepts that allow you to take that journey, grow it, and ensure that your organization is ultimately not only delivering to your customers, but to each one of those components that's been identified. So that's just a broad kind of overview for the program. So again, that we can level set. There's obviously opportunity with both to spend the entire program just talking about the pieces there. But we'd really like to be able to get into some specifics about the experiences that the panel has had with both programs, and to give you the opportunity to ask these experts questions that may help you on the journey that your organization is taking. So with that, we're going to move into some questions, and we encourage each of you to optimize the chat box to pose any questions that may come up as a result of the responses that you're receiving. What is being demonstrated or shown right now is this crosswalk between the two programs, really illustrating that there's a lot of commonality between the two. There are obviously specifics to each program, but the overarching idea that we want to get across to each one of you is that these are components, programs that will allow you to take a critical look at your organization, determine where you are now and what it will take to get you there. While John's opportunity or achievement, I should say, is somewhat unique, there's only ever been one other hospital in the history of Baldrige who received the award the first year out. And that was Bronson out of Michigan. That is not the norm. You know, he laid a foundation, they developed the program, and they were able to present through a very difficult year that we've all had for the award. And I think it's a true demonstration of the leadership that came from all levels, but particularly from John and his team, to be able to drive that dynamic. And with Dina being part of this panel, I really would hope that you would optimize the knowledge and experience she has with Magnet. Magnet is not an easy process. Many people struggle for multiple years, and Emory right now is the most Magnet awarded organization in our state. And so really, truly take advantage of the opportunities that you have. Dion will be able to help guide questions about how you get started on this process. Many of the starting components for Baldrige have to start at a state-based program. So with that, let's get into the questions. So the first question we have posed to the panel is, what factors impacted your organization's decision to pursue either Magnet designation or implementation of the Baldrige criteria? If we could start with Dina, please.
Thank you, Rebecca, and thank you for allowing me to be on this panel, very esteemed panel of my colleagues here and everyone that's on the call today. Thank you very much. I think as you framed it up is great. As we think about Magnet or Baldrige, we've here at Emory, we talk about lean and our lean journey, and that being our production model. It's not a flavor of the day. And so I think that's what we need to all keep thinking about. Whatever fits best in your organization is where you need to go. But the fundamental piece of that is excellence, right? That is our business. That is patient care, and how do we deliver excellence in everything that we do to our patients, and use these different models and frameworks to get there. But to answer the question, Emory made the decision many years ago, and you're right. It's a long journey. It never stops. On the Magnet journey. It takes a long time to get your first designation, because there's a lot at stake there. We have, I'm going to go back about 15 years ago when we were, maybe longer than that, when we were one hospital system, Emory University Hospital for the most part. We've grown now to 11 hospitals and 130-ish freestanding clinics. And that decision that was made 15, 20 years ago really focused on who do we want to be. As Emory is continuing to grow and expand as an organization, it was more about who is the internal piece of who we are, what is our mission. And our mission is delivering excellent care. We also look through the lens of who is the art of that, who's the heartbeat really of our organization. It is our nurses, also our physicians and other practitioners that are there. And so that was how we framed it up many, many years ago. As we have continued to grow and expand, our board has said from the beginning, which is great, we will embrace Magnet from the board level because that is who we want to be. And the expectation, accountability, is that our entire system will be Magnet designated by 2025. So we're making, we're pushing up on that very quickly. It is a huge monetary investment that we make, but it's got to be all in. So it's nursing that helps drive, and we're looking at nurse sensitive indicators all throughout inpatient and outpatient, and how nurse sensitive indicators, because they're spending the majority of the time with the patients, and how does those nurse sensitive indicators measure how we're doing. We look at that very closely to really impact both our patient outcomes, patient experience. We look at our workforce development, recruitment, retention, all of that frames up who we are as an organization. And when you see Emory, or you touch an outpatient clinic down in LaGrange or up in Hiawassee, Georgia, or Emory University Hospital, that the patient won't be able to talk necessarily about what Magnet is, or if it was a Baldrige hospital, but say, this is different here. When I walk in here, I feel like I'm a part of something big. I have an outcome from the experience perspective and from care delivery, that I know something big happened while I was here. And so that is our mission. That is why we chose Magnet, because it embraced really the mission and values of who we are as an organization. So hope that answers a little bit. That's kind of high level, but of some of the reasons that we made that decision 15, 20 years ago.
I appreciate that. The challenge is always to try and get all the words in the amount of time that we've been given, because we could probably talk about this for hours. But John, how about you? And Pauline's journey.
Yeah, for me, and the decision around Baldrige is really a decision of, as we are looking at healthcare, right? The complexity of it, the constant changing in healthcare. I believe what is essential is for an organization to have an operating model, right? It has to have a framework of which to create standard work, to create processes and approaches that work, are measurable, and make an impact. And so, the Baldrige criteria is really boils down to a set of questions, the right questions, challenging questions, but it's a set of questions. And so creating a framework creating an operating model utilizing the framework through those questions allows us to create a culture and environment that is not reliant on a single person, that assures that it's every patient every time. And knowing that we aren't perfect, and when it's not every patient every time, that we have a process of how we improve from it. So it gives a common language to how you practice good business, and it creates a framework in which to make that impact, in which to organize the work that we do.
Great, thank you so much. Dion, let's move to you if we could. If an organization wanted to pursue Baldrige designation, how would they begin?
Well, the Florida Sterling Council, and by the way, we're still the Florida Sterling Council. We are soon to be the Sterling Council, because 4 years ago, Georgia joined us in that initiative. And we now work with Florida and Georgia, and we're fortunate that Georgia has joined Florida in this initiative. But we're part of the state alliance. There's a state alliance for Baldrige. There's about 40 of us that oversee state award processes across the country. We've been doing that now, and this is going to be our 30th year. We're going into our 30th year as being a state award process. What we're able to do is we take that Baldrige framework. We happen to call it Sterling because we market it and customize it a little bit. I mean, not every so little bit. It's pretty much the Baldrige in a Sterling jacket, but we take that framework and we go through an annual assessment process where we invite organizations who are into performance excellence and into a systems approach using this framework to apply. And it's an opportunity for any organization from any sector. We were the first award process to open it to all sectors. From the very beginning, we had hospital healthcare, we had manufacturing, we had government, not-for-profit, we had education, and we had service, because we believe this model applies to every sector in any line of business. So we have that process every year. We have year-round processes. We have various assessments. One is the Georgia Oglethorpe Award for Georgia, which is the highest level, which basically is commensurate to the Baldrige. I mean, if you're doing Georgia Oglethorpe, you're at the Baldrige level of the criteria, 50-page application, answering those questions that John talked about. That's part of that framework. And, what we do is we accept that application online, it's electronic, and we basically put together a team and do an assessment. I think a little difference with the states versus Baldrige, we're also into education and training and learning. We try to help organizations get started. So In addition to the Georgia Oglethorpe Award or the Governor's Stirling Award in Florida, we also have other assessments that are consultative and advising assessments where it's based on the same criteria, but it's basically getting you started maybe with a move forward versus just jumping in with that 50-page application at the Baldrige level. So we've been doing this now. We're finishing up our 29th year, going into our 30th year the upcoming year, and this is going into our 4th year working with the state of Georgia. So we're excited. And Wellstar, we know John's organization, Wellstar Paulding, was a Georgia Oglethorpe Award recipient 2 years ago or 3 years ago. They were our first year when we went into the process. And this last 2 years ago, Wellstar Kennestone also was successful in winning the Georgia Oglethorpe Award. So we've had 2 Wellstar organizations that have been successful in completing the assessment. And again, it's any organization in Georgia. We are working with other organizations outside of Wellstar that are doing other assessments, and any type of organization. In fact, we're going to be getting a managed care organization. Health hospitals are one, but managed care organizations can come through as well. Anyone who meets the criteria, which is pretty much open to anyone in the state that is an entity that has a governance system that is basically an entity that can answer the questions, can apply. Okay. And we're always excited to have more Georgia organizations come through. So hopefully, as we continue to move forward, we'll see more Georgia organizations applying for the Georgia Oglethorpe Award as well.
All right, thank you. John, can you talk a little bit about some of the specific challenges that maybe you encountered on your journey to excellence? I mean, obviously, it's not for the faint of heart, either one, Magnet or Baldrige. So talk a little bit, and then we'll go to Dina about some of the specific challenges that you encountered.
Yeah, I think the first one is you can utilize the Baldrige framework without writing an application. When you make the decision to write an application, that's tough. I mean, it's counting the org profile. It's a 55-page document that is pretty dense, but you have to get a lot of information into that in a very succinct way. So that's the first barrier. When you make that decision, it's identifying and figuring out how to write that application. I think applying the framework, the biggest challenge is being open and honest with yourself. As you start to read the questions, you may think as an organization, I've got a great strategic planning process. And you start reading the questions, you're like, well, we don't really do that. We don't have an answer for that. I can't really tell you what our leadership system is, whatever it is. Having that openness is difficult, and having that your entire organization have that kind of openness with knowing that you've got to identify where you have opportunity for improvement to get ready. And they're ultimately the right questions, right? They're how we get better. So I think that's an initial one. And then, it is getting everyone aligned to the language, to what Baldrige is, why we do it, takes some time, and getting your team aligned around this work is initially a challenge, but I would offer up, and what I believe to be true is, if you can do this and do this well, although it feels like a challenge at the beginning, ultimately you stop firefighting in your organization, and you're more proactive, and it actually gives your team members more time to focus on the right things. So it is well worth the effort, but it is certainly an effort. And then the last piece I would say that I think is highly important is the executive leaders have to be on board. From the top of the organization, they have to lead it, they have to carry the flag, and that can certainly be a barrier sometimes if you don't have the entire executive team bought in and with that understanding. But I absolutely believe it has to be led from that place.
Right, thank you. Dina, how about for Magnet?
Yeah, and I would agree, ditto for a lot that John just said, but to add to that, from the Magnet perspective, it is about true enculturation of all the principles. It's building a professional governance structure, and that sounds maybe lofty or different, but how do you really, from the frontline clinicians that are touching and doing the work every day, is their voice the most important? How do you build that culture and have that true professional governance piece to really move the metrics? If we want to look at quality metrics or patient experience, like I spoke of earlier, and a real true engagement of our team members, they have to be able to own their practice and build that We as leaders, responsibility is to react to that, break down barriers and help that, but they have to build that. But that's a shifting of a paradigm that, you have to really turn that triangle over from top down, executive team telling you what to do to we're here to support you, drive your practice for that. And now that sounds like a great thing you want to do, but sometimes, it takes some acculturation of that, as I said. So that to me is the biggest challenge. Although it's the right thing to do and people love it and they get on board, it takes time though to really build a culture like that. And you have different cultures, and then you have microcultures inside your culture, right? And when you look at your big operating units and then down to every local unit in a different area, and how to develop and build that is the challenge, although one that you want to take on because it is the right way that you want to practice and the right way for us to deliver care.
Thank you. Let's talk a little bit about some of the organizational assistance, maybe. So how has the journey that you've taken with either program, and we'll start with Dina this time, how has it helped you in the response to the pandemic? What impact has it had on the steps you've taken?
Yeah, I think just a follow up from what I just said, having, it's not perfect everywhere, but having that culture of frontline clinicians driving their practice and being able to say, raise their hand, this is not going well, I need help here. We need to be able to shift and pivot or be agile and be able to do that. That's what we were able to do during the pandemic. If we had not built the structure for this, not have the professional governance and our frontline teams being able to be this nimble and be able to say what needs to happen, and have our executive teams again react to that and help build or break down barriers if they needed it, we would not have been as successful as we have been during the pandemic. Just boots on the ground examples are from my ambulatory perspective. That's where I live. Being able to last March shut down all of our ambulatory surgery centers in practicality. And divert almost 80 nurses that just immediately said, we want to help, we want to do whatever. Stood up a RN COVID hotline almost overnight. They went from practicing in the OR to being able to deliver telehealth nursing, very much out of their, but they understood the nursing components of that. They wanted to jump in and help. They were very engaged, wanted to do that. As just one example. But if we did not have the structure and that type of culture already here, it could have been a lot more difficult to be able to be that agile, and for our nurses, and not just all of our care team members, to really be able to not just survive but thrive in a pandemic that we just hopefully have come through on the other end. So that's just a immediate example, but that is really what has brought us through, is that professional governance of our team members.
Okay, John, how about for you?
Yeah, I certainly have to agree with Dina. The big focus here is around culture and creating a culture that's aligned, a culture that understands where the organization's going and the why behind it, that's passionate about serving the community. It gives a good place to start when something like a pandemic hits. And the last year has been amazingly challenging. I think the hardest year in healthcare probably in the history of this country. And so having this framework allows us to be nimble. It allows us to have approaches that everyone understands. Things like a communication system. We have a defined way in which we communicate with the staff. And when you have messaging changing what felt like hourly from the CDC at the beginning of it, how you communicate and everyone aligned to that's very important. Also the way in which we measure, the way in which we listen to the staff and engage in the voice of our team member and the voice of our customer is highly important. And having those systematic approaches to be able to do that allowed us to pivot when we needed to educate where we needed to communicate differently when we needed to. And so, the framework in Magnet, I know is the same way, is not intended to create something that can't be changed. And in fact, it's quite the opposite. It allows us to be more nimble because we've defined how we're going to operate. And so through the pandemic, it's allowed us to do that. And I believe we're able to be more resilient with keeping our turnover lower than a lot of the country, with nursing, with overall turnover, with resiliency. Paulding's we were able to stay on top of the great places to work metric for the system. And so I think there's a lot of outcomes that shows that having that culture and operating framework in place makes a huge difference.
Okay, great. Baldrige and Magnet, both other performance related systems, have really, particularly through this year, had a huge focus on the term resiliency. So it's interesting to me that you use that there. But Baldrige defines it as the ability to anticipate, prepare for, and recover from disasters, emergencies, and other disruptions, the unanticipated. But also to protect and enhance the workforce, customer engagement, supply networks, all those things that are necessary for us to do business. Can you give me a couple of examples that demonstrate your organization's ability to demonstrate in the terms of Baldrige that resiliency component? Just a couple of examples.
Yeah, I think there's a lot that's going to be an unfortunate downstream of the pandemic. There is a subsection of our workforce that is going to leave healthcare. They're burned out. They're leaders who are not going to want to have to rebuild post-COVID of getting the staffing back, figuring out agency, versus not, and rebuilding the culture and listening to the team in order to drive resiliency. And so, I would say there's a couple of things that happen. One is a system. Wellstar has been highly focused on this notion of resiliency. So ensuring that we are giving a critical pathway for our team to have conversations with mental health professionals, with helping to provide wellness space, right? Building wellness rooms at all of our hospitals. So there's a lot of those kind of tactics that we did. I think though the overall, when we think about resiliency, it comes back to culture. And I know everybody's probably going to get tired of hearing that, but this notion of resiliency can't just suddenly be turned on. You can't suddenly have a resilient organization. It's something that's built over time. And when you're very intentional and systematic about how you lead, right? And it's not a haphazard leadership. It's a defined approach to how you lead and how you create a culture. It leads to that resiliency. And it's something that it's something you have to be active in every day. Being a leader means being there to serve your team. And so I think that building of the culture, and I know, again, you may get tired of hearing us reference that, but that's what the intent of Magnet and Baldrige both are.
Gina, anything to add there?
Well, obviously, we're singing on the same song page, John, but well said. From that, I think the focus, the only thing I would add to this, and I'm a nurse, old nurse, and it's all patient-centered. Patients are always first. What we've shifted to that is that our people are first. If we take care of our people, and truly take care, compassionate care of our own people, our Emory family, our people, then the care of the patients and all those other things is going to skyrocket and go right in. But that is a shift from the way we've always been taught and the way we think. It's not that patients aren't important, of course they are, but if we focus first on our people and building a place they want to work and want to grow, even in very tough times. John is right. Yeah, we have lost people. We'll lose people, unfortunately, in the profession. But if they're grounded to the why, what our mission is, who we are as an organization, and who we serve, and they feel engaged and a part of that, even in the tough times, then that's what they can anchor back to for that. And so, yes, a few things we have, thankfully, we've lost people. We've had turnover rates higher than we have wanted to have, but much lower than the national average. I want to attribute that to our culture and our Magnet work. Our patient experience scores have stayed top decile. That goes back to anchored into the mission of who we are, even in really tough times. And it's been really hard to deliver care. The patients have still felt that and still are recognizing I'm still in the right place and I'm still where I want to go. So that patient, both our retention rate and our patient experience rates have stayed as we wanted them to over this last year because of that.
Great. One of the things that many organizations get concerned with is after coming through something like what we've lived through for the last year and a half, obviously results in many areas will be lower than you might normally see. And obviously, declines in performance are not the way that we want the area to go. You know, I think back, of course, I'm an old nurse too, Gina, and John's a young nurse, but you know, I would just, you know, those are the things I think that build a commonality of purpose. And I would like to just share as the moderator one example that I know that Emory had this same experience because I saw it. I had EVPs giving vaccines. I had EVPs, you know, handling the call center. You know, when people step up, that creates that sense of resiliency and it creates that sense of commitment in your employees. But what other kinds of things, Dion, might examiners be looking at as illustrations of the term resiliency from a criteria perspective?
Well, you know, it starts, like John said, in the criteria with, you know, leadership, category 1. I mean, we, in our criteria, and resiliency, by the way, is an integrated concept across the process categories. It's not something you just see in one place, but it does start with leadership. We will ask senior leaders to give us evidence of how they demonstrate as senior leaders resiliency. We want examples. We want evidence of systems that leadership has to really hardwire resiliency into the work that they do and how they communicate, how they create that culture, how they really ensure that resiliency is how their organization lives and works. I mean, we're looking for that evidence. You see it in planning. I mean, how are you really, engaging in resilient thought process as part of your strategic planning process? Because again, you know, that's something when you're either an agile or resilient organization, it's something that's very conscious and very deliberate that you've done to have systems in place that allow you to pivot quickly, that allow you to move in a direction that's going to give you that opportunity to be able to continue to serve and continue to do the work you need to do. We worked with a lot of organizations this year. We still did assessments during the COVID. And what we were probably ultra impressed with was the ability of these organizations to pivot and to continue to really fulfill the mission that they had in serving their customers, even during COVID. So again, it starts with leadership. It's part of the planning. It's part of your focus on how are you really continuing to serve your customers? How are you measuring that? Resiliency, how, you know, because again, everything you do really has to have a measurement system around it. And then we look at your processes and your people having that, you know, again, from culture, it starts with the leaders, but it has to be, you know, the workforce has to agree, because it's the operations every day where you have to demonstrate that resiliency. So your employees have to understand how they have to be agile and resilient and continue to evolve throughout the process. And I think this year we were probably as impressed with the systems framework that people had that allowed them to be resilient. Because again, without a systems framework, resiliency can be really haphazard, and you're not really going to have that, what you really call true resiliency. You're just going to be changing and reacting versus being proactive and really putting in place systems and agility that allows you to be resilient to the changing environment, the changing conditions you have. And it should be something that's not just during a crisis, but should be something that you're doing on a regular basis. How are we resilient to meet the needs of the customers as they change and our workforce as they change? But it starts with leadership. And we all of our assessment, and I want to echo what John said, it starts with that, with the senior leaders. And with any of these, I know I'm familiar with Magnet as well. If you don't have senior leaders buy-in and passion for it, you don't go very far. It's just not gonna, because the employees know whether, or the workforce knows whether or not leaders are really truly engaging in this exercise, or is it just another program or flavor of the month? So it really has to be something that senior leaders buy into. It's the culture, and it is something where they can really hardwire the expectations throughout the organization. Right. So it starts with that culture and leadership with everything you do, including resiliency.
Well, you know, as you mentioned, both programs really focus and look at the impact of an engaged and satisfied workforce. Dina, can you talk a little bit about the efforts your organization is making to address some of the national challenges that we see as a result of, you know, a huge media presence and real-time viewing of issues that we as a country would certainly like to not ever happen, but certainly not repeated, as we look at issues related to diversity, equity, and inclusion?
Yeah, glad to. And I'm going to build a little bit on what Dion just said. Starts at the top, and leadership matters. Is it a flavor of the day, and is it a check the box because you feel pressured because you need to do that? If that's the case, then we're in trouble. And that is not the way we want to look at things. So as we're looking at DEI across Emory, it's, to me, it will also be a journey. You don't haven't arrived and all of a sudden everything, on June 1st is what, in a perfect world. That is not at all what this is about. It truly is, and this is how we're looking at it and approaching it. It needs to be woven into our fabric. Eventually, a day will come when we don't need to talk about what are we doing for DEI, because that will be so foreign. It will be who we are, what our culture is. But use that word again, and really a full immersion and weaving that in. And so that is the tactics that we are taking now, though. But you have to do something, right? You can't just say those lofty words and not do something. So doing something like hiring a chief DEI officer, doing something about having very focused work, talking open forums, town halls. It's laser focus, I'll just say that right now, across all of our areas. We don't have it all right yet by any means, but putting resources, put your money where your mouth is, and really doing that work is where we are now. But building it in to where one day it will just be who we are, and we don't have to call those letters out anymore because it's so woven into our fabric. So that is our approach, and where we are. But starting with let's put resources truly into it and let it be top of our tongues on every agenda. Continuously talk about it and really build the platform and the structure and the culture that we can all thrive, regardless of who we are, and respect each other. And love the uniqueness of 30,000 people that bring unique, things to who we are, which is wonderful. So,
Thank you, John.
Yeah, I couldn't agree more. I think we're at a place where we've got to have these initial efforts, and I think we all want to get to that place where it's just part of our culture. It's who we are. Wellstar is doing a lot of the same things Dina just talked about, hiring a chief diversity officer. We are implementing a diversity, equity, and inclusion council at every site in the organization. And then they have representation at a system diversity, equity, and inclusion council. And so, wanting to go from that discussion and listening, which is highly important, but then move into empowering that group to help us make decisions, to help us ensure that we are listening. One of our values at Wellstar is honoring every voice. And what a great way to do that by empowering our team members through diversity, equity, and inclusion councils to help ensure that we are meeting that value. And so for us, it's creating that structure and framework. And I think to Dina's point, that embedding into our culture so that it is just part of who we are. And it's not something that we have to bring up separately. It's just who we are. We value that diversity, equity, inclusion. And how important is that? I mean, you absolutely have to have diversity within your team and within your employees, or you're not a very good team. And so it's exciting work. And I think we've got, certainly as industry, as country, all those things, we've got some work to do, but excited about where it's headed.
Can I just add a comment on that? I know that Rebecca understands this, but the Baldrige Criteria framework is upgraded every 2 years to reflect current trends, standards, and best practices around the industries that we serve. And diversity and inclusion and equity were one of those concepts that really has been hammered, but this current year, it had a much more full and much more robust inclusion. And it's something that we're looking at. I mean, it's across all the criteria. Again, it starts with leadership, where you look at how you really look at organizations, the leaders, how they consider equity and inclusion in the culture and what they do to support the organization. And it goes again across all the criteria, including a big presence within the workforce, where it really is even part of the performance management system, where you're really looking at that diversity and inclusion, and you're monitoring and managing your systems to really support that. Again, it has to be intentional. Whenever you're looking at these concepts, it's not just words on paper. It's a very intentional practice that has to be woven into the fabric of the processes and the systems, starting with the culture. And then again, it's even in the performance management criteria, where you really are saying, how do you really include that in your management when you're reviewing performance management and including that discussion? So it's an important concept. And what I like about Baldrige Every 2 years, they update the criteria based on best practices, based on surveys they do, based on feedback from the industries that they serve. And they made sure they maintain currency, because the criteria can't just be stagnant. It has to continue to evolve to include things like resiliency, include things like diversity and inclusion and equity, and to make sure that we're not just living in the past, we're living to the future and looking at the future with how we need to manage.
Yeah, I think the one thing to just kind of point out, and I know that the panel here understands that, I want to make sure that the participants do as well. When you look at culture, when you look at diversity, you look at equity, this is not based off of one component. Lots of times people get very stagnant in their own thinking. I always have to remind myself there's a defined definition. It's not about race. It's not about gender. It's not about, the ethnicity or cultural component of any one individual. It's all of those things and more. You can think about different places in our country who are racially very limited in their diversity. Well, then you have to start thinking beyond simple color of skin, and you're thinking about, well, where is the diversity in belief and thought? And it just gets so large, it becomes really an uplifting and really interesting and energizing kind of discussion to have. So I appreciate the input there from the panel. One of the final questions that I have really is thinking about the charge and responsibility that each of you have to the profession as a whole, to the country as a whole, when you take on these kinds of journeys towards true excellence. As these awards or designations are levied, you have a responsibility to then be able to share your role model practices with others so that they can grow and learn and achieve the same types of outcomes. So if we were going to look at any one organization, what do you believe are your role model practices that others could really benefit from and improve their organizations? John, let's start with you.
Sure. Thanks, Rebecca. One of the things that we were noted from our feedback report this year was our use of lean. And I know that's a buzzword out there that a lot of organizations use components of lean, or they dabble in lean. Our entire management system is lean based. And so everything from how we do strategic planning, how my work is done as a leader through leader standard work, all the way down to how we cascade goals, how we do performance improvement, how we engage the frontline staff in helping us improve both through gaining ideas from them, but also through helping trial processes. Every single unit in our organization utilizes visual management across the board with no exceptions. And so the way in which we've deeply embedded our lean management system at Paulding is something we believe is role model. It was recognized by the Baldrige examiner team as being role model. What was really interesting to that note is the other healthcare winner recipient this year was Greater Baltimore Medical Center. And during the Quest conference, I got to listen in on some of theirs, and they too use lean very similarly, and was like looking in a mirror with a lot of the stuff that they do. And it was interesting validation of how important that work is. And so for us, we believe that that's what has made us successful and helped us answer the questions in the Baldrige framework through that lean management system.
Thank you. Dina?
Ditto with the lean, but I will use another example. As we're looking at role modeling, and maybe when we have role modeled well, I will have to anchor back to our St. Joseph's Hospital that has just received their 6th magnet redesignation. That's one of the longest in the country. And what has grounded them and made them stand apart, and that I've learned from certainly, is that, again, that I'll say a concept, no longer a concept. It's how they practice. Is that it used to be shared governance, professional governance model. Tim Porter O'Grady is the father of professional governance, and he was a staff nurse many years ago at St. Joseph's, and really brought that to life and what that looked like if nurses own their practice and our accountability and responsibility, and then own that, then the quality metrics follow, right? And so that's what we have modeled after. And so that has really been the role model that Emory, as St. Joseph's became part of the Emory family, we have learned from St. Joseph's, and then that has been modeled throughout the country through that robustness of a professional governance model. Also difficult to do. Working on that right now in our ambulatory care practice. How do you look at nursing professional governance with our team members? Because while inpatient and outpatient are similar, they're also different. And that team-based care model truly especially in the clinics with the physician and nursing and MAs and administrator that live, breathe, sleep together all the time. And how do you truly build that in a professional governance? So we have multidisciplinary team members in our professional governance team, and leading in that across the country. So we're kind of doing some speaking around that. So that is one thing to me that's a little bit differentiator. It's the fundamentals of Magnet. It really is. But one thing that we've been able to role model from our roots many years ago at St. Joe's.
Thank you. Dion, anything to add there?
Well, as part of the Alliance, we always are looking at states that do things differently and who's, has different attributes that may be best practices. I know the one that the State Alliance always shares related to Sterling is how we basically put together our education and learning around our conference and our activities, because to be passionate about excellence, you have to continue to share and, promote what is the best thing for our country, which is the Baldrige model. It has been out there for 37 years as the best practice around how do you really drive leadership performance excellence in our country. Remember, it started because we were failing as a country and we were behind all these other countries and how we were really leading and being competitive. And so the Baldrige model was put in place to address that failure we had as a country to really compete worldwide economically. And so our passion is around sharing and promoting that through that the conference that we do that really is all about applied learning, because again, we truly believe that you can teach, but it has to be applied learning. It can't just be theory and practice. It has to be, how do you apply it? What are those takeaways? What are those practices you can take back and immediately institute? So we constantly get that feedback that is one of our best practices. Another area I think is really important is our examination process with our examiner committees and how we operate. We're truly a volunteer-driven organization. I mean, we're a very, very small staff. There's 5 of us in Tallahassee that oversee the process. It's our 150 plus examiners that really govern and set the standard for how we're able to do our work. And our governance system around the examination process is we really collaborate with those examiners and the leaders, the steering committee, and Victoria's on that steering team with our exam committee. They really drive our process, the improvement. We take all the data in every year. We look at we get feedback from our examiners. We look at the applicant feedback, and we look at best practices and how we did virtual this year, which we pivoted very quickly. How will we continue to evolve with the virtual? So another best practice is how you really collaborate with the volunteer workforce that are really the power behind any of these assessments, and really continue to change and evolve based on collaborating with them.
Well, I want to just share with you, this WellStar has been the first organization in my 20 years of being a national examiner that has ever been on this journey. And I've worked a lot of places. I've always done Baldrige. That's part of who I am. It's in my DNA at this point. Victoria will tell you that I live, eat, breathe, and sleep Baldrige. I love it. It is a passion. My children, grown, oh gosh, it's Baldrige time again, but I just tell them they don't have a systematic process for cleaning their rooms. But when I look at this and I look at the options and the opportunities, as you heard from my bio, I have done a lot. In fact, right now, I think I'm the examiner with the most site visits at the national level. I have done this for many, many years. I do it as a volunteer, again, because I love it. But I want to share with you one innovation that I learned very early on, probably my first year. And I was a pretty, green nurse at the time. But I had this opportunity to come and do this. And I got to an organization, to remain unnamed because everybody remains anonymous from the examiner side. And they were losing nurses left and right. They couldn't understand it. They couldn't figure it out. And they went, as Dina said, to the source. What is it? They were also on the journey for Magnet at the same time. Their nurses were primarily single mothers. They were in a very high cost of living area. they were leaving and they were jumping ship. This may sound familiar this year, y'all, to go to sign-on bonuses and higher pay. A little bit familiar? What they did was they made their badges an ATM card, and nurses could out at the end of their shift if they needed to, with no penalty, because that's what they needed in that environment. That's what the nurses needed. They went from about a 32% turnover rate to a waiting list for positions. And it wasn't really because of what they did. It was because they listened. It's because they empowered. It's because they created a culture. And that's really what both of these programs are designed to do. You can hear the passion in all of your voices. I hope that the attendees can hear that as well. It will make a difference. It doesn't matter whether or not you choose one or the other. It matters that you choose something to move forward, to propel your organization to true excellence. I hope you all have enjoyed it. We're going to open it up for questions and give the participants a chance to ask the panelists anything that's on their mind after you've had a chance to hear a little bit about this. Bruce?
Hi, Rebecca. I have a few questions in Q&A. I'm Bruce, by the way, GAHE's Executive Director. If you do have questions, please ask them in chat or unmute yourself and ask them directly to the panel. The first question, how has Magnet or Baldrige helped your personal leadership style? And how have you personally changed or grown as an executive?
Yeah, I'm happy to jump in. I can tell you, Baldrige is humbling. When you think you're doing something well and you have a group of external people come in and maybe tell you that it's not where you thought it was, it can be really humbling. So there's a couple of things that I think it's helped with my leadership style. One is learning and embedding lean in the method in which we did helped me organize myself as a better leader and be intentional. And I would say earlier in my career, I thought leading meant like showing up and doing the best I could that day and being excited about being at work, but that's not the best way to lead. Instead, it's defining what does it mean to be a good leader and what are my actions to that and then committing to it, right? What is it, rounding? If I commit to rounding, have I created priorities so that I can do that? What am I going to do when I'm rounding? Is it just haphazard? Is it intentional? And so it's helped create a very intentional approach to leadership and sort of set a standard across the organization for what it means to be a leader at Paulding. We all sign commitment letters that are based on our leadership system. And as a leader at Paulding, you have to sign that and we frame it and you're asked to keep that on your desk at Paulding so that every day you're reminded of what it means to lead at Paulding. And so that starts with me. If I don't have that same commitment, I can't expect others to. And so it's given that framework. But then personally, it's helped me grow and be a more organized leader, a more intentional leader, and a more a clearer leader with my intentions and why we do the things we do.
I would agree with the humility side of things, and I think really to think about maybe the servant leadership piece. When you maybe thought you were a servant leader, this should. Really say this is really what it truly means to do that. Yes, you need to be a transformational leadership because you have to help set vision. You need to be able to have the senior leadership buy in and be able, sometimes that means change things, which can cause some dissonance for that, and that's okay for that. But it really roots back to your people, how you build the structure for the people that are going to be doing the work and tuning in mostly to that. And then your job as the transformational leader may take on a little bit different shape there, but you really, that servant leadership piece to me is what has been the most impactful and important piece as we're supporting the work of our people.
This is Deanne. One of the things we see a lot is the importance of trust with leaders as well. When we're out there because when we do an assessment and we're talking to people and the leaders in the organization, what's important for us to understand, and there's a couple pieces there, one of which is what's important is getting communicated, and there's a systematic approach to that. But what you really learn very early on is their trust and respect. Do they believe the leaders are they doing a good job of communicating what's important? And do they trust that they're basically care about what's important and care about them as employees? I mean, that whole trust and that culture around engaging the workforce, making sure that you're really in sync with what's important to them and that they can come to you and there's trust in terms of that belief that leaders are committed to what's really right for the organization and right by the workforce in serving the customers. So I think trust is always so critical. We see it, if that leader is truly someone who is leading the organization, you'll see a lot of trust, engagement, and you'll see a very effective communication system as well, where it's not just one way. The leaders are out there and there's really strong hardwired communication that's coming from leadership throughout the organization.
Great, thanks. I have another question for Dion. Because you work with industries from multiple segments, what are some things healthcare organizations can learn from non-healthcare related companies on the Baldrige journey that would be valuable?
Well, there's a few answers to that question, but there's one that goes back a long ways. I know that when the Ritz-Carlton won years and years ago, and we even had hotels within Florida that went from the award as well. What I know a lot of our healthcare organizations learned about is hospitality. Cleaning the rooms, serving the food, looking at what their systems were and what their approaches were. They did a lot of huddles every day, and they talked a lot about how they were communicating what was important to serving the ladies and gentlemen. And I know that in the early years, a lot of healthcare organizations really understood a lot of, within the service industry, how do we do a better job of serving every single day? How do we do a better job? Like I said, they did their huddles every morning where they communicated the message of the day, what was critical to our success, would talk about issues that were happening in the hotels every day, where they could talk about, here we have certain guests checking in, or we have certain issues that we're dealing with. We all need to be aware of it. They had great databases for customer information as well that they captured. But I think across the board, it starts with leadership, and there's always something to learn from how leaders lead and understanding how they do their work every single day. I see a lot of effective communication systems with pass up, pass downs, and all kinds of different things that leaders have learned from each other. How do I really do a good job of this? And how do I continue to hardwire effective communication approaches across the organization? I think that's been something that's really universal, is the leadership system. I do know that there's obviously organizations such as, I know in the early years, folks like Boeing and some of those role models had tremendous strategic planning models and systems. We're really putting together a plan, looking at how it all connected, looking at one of the things that was really important was the golden thread, top to bottom alignment. I think that that's something that the private sector set the way for, especially the manufacturing and service. And I think healthcare learned a lot from how to really do effective strategic planning. Not that they're not doing a good job now, but I think in the early years, they really understood that business model a little differently, how to really prepare an effective strategic plan, and how to then align and cascade those action plans all the way down to the workforce, and then tie that back to performance expectations and measurements. You can really almost look at any category and find something that is a best practice that you could share across industries. But I think healthcare has probably been, I know in the last 10 to 15 years, and Rebecca, you can help me on this, healthcare has probably been one of the leaders across the Baldrige industry. They have really set the tone and really have become those role models across the country. Healthcare is our number one industry who's really adopted the Baldrige model and done well.
Healthcare has really taken a lead. They submitted, and it took a very long time before we got a healthcare winner. And once we did, and other organizations, other hospitals and healthcare entities realized it was possible, it's just exploded. It's been really amazing. And John mentioned going to Quest. If you've never had the opportunity to do that, I would say whatever you can do, scrape that money together and go. Because it's not, let's be honest, it's not cheap to go. But what you hear is sort of a lightning rod, I think, to change within your own organization. And my husband asks me every year, why do you keep doing this? It's volunteer, and it's a tremendous amount of work. It really, really is. But it's the learning, it's the opportunity to see organizations that refuse to believe it can't be done. That is just not in the makeup of these organizations. They're going to find a way to go over it, go under it, go around it, or by gosh, go through it. They're going to get it done. And those are the people that I think create the sense of energy in the rest of us to really think in terms of our own organization about how can we get there? I mean, listen, not to discount the leadership that we're talking about here, because John and Dina are tremendous, but they have both freely admitted it takes way more than them as a single entity to get to where they are. But it starts with someone. It starts with someone having that idea and that sense of initiative to then convince other people to come along for the ride. And it's a ride. It really is. But when you get to that point, what you realize is it's not a destination. It continues. It gets bigger, it gets better. And at the end of the day, that's what we all want to be.
Rebecca, I'll just add something. I know we've had several of our examiners over the years that have said being a Baldrige examiner or Sterling examiner is like having a mini MBA, because you're learning and you're seeing from a practical application standpoint, how do systems work? How do things get integrated across an organization? What is the business acumen? What's relevant and what's critical in an industry to really make it successful? Because depending on the sector, healthcare is different than manufacturing. The things that are relevant to healthcare, the things that are relevant to manufacturing are different. And you have to understand that relevance and apply the criteria in a way that really makes sense to them and is relevant to them, not one size fits all. It is really something you have to be able to adapt. You have to have critical thinking skills, and you have to have good analytical skills where you can see how things align, how process drives results, those kinds of things. So I do think that, the learning around, going through this, like you said, is tremendous. And it really is eye-opening for people that really want to continue to grow in a world-class, best-in-class performance management system.
I would hazard to guess that the majority of people on this call probably have an MBA. And if you didn't get it through a formal program, you sure got it by the School of Hard Knocks. I will tell you that Baldrige it's both more rewarding and harder than my formal MBA was. But obviously it's an addiction because I keep coming back every year. But it again is one of those things that is self-affirming for your own commitment to making our industry better. Whatever role you can have in that, whether it's within your own organization or participation in one of these programs. And, Baldrige is near and dear, but Magnet is a journey that I've been on with other organizations, so I'm pretty familiar with it. And the tremendous benefit it brings and the sense of pride that both bring to an organization is part of the fabric of the culture that then builds that commitment and that focus so that you get like-minded people, and in a good way, to be able to drive that service to your customers. I would say honestly that manufacturing is just like healthcare. Education is just like healthcare. When you break down the pieces that it takes to be really good at what you do, you have to be good at each one of those 7 category items. The 7th being the results. Can you demonstrate the proof of your efforts? And I hope you hear it in my voice. I am so passionate about this. There is an emotional response that's there because I know it works. If you get people focused on excellence, whatever program it is, you will achieve excellence.
And Rebecca, can also add, so I also serve as a national examiner and a state examiner through the Florida Sterling Council. It can sound intimidating to get started, but going through examiner training is a really great way to understand and learn the Baldrige criteria. Mm-hmm. And so even if it's something you want to apply in your own department, even if your organization's not formally on the Baldrige journey, I highly encourage a really great place to start is as a state level examiner. And you don't have to jump straight to national. In fact, it can be hard to get into national without having some state experience. And so would certainly encourage this group, if you have interest in that, to reach out to Dion and figure out how to get connected as a state examiner. It's very rewarding. You learn a ton. And it's a really great way to start understanding the Baldrige framework and how to apply it.
Dina, can you talk a little bit about what opportunities there may be for Magnet for individuals who want to learn more about that program?
Yeah, for sure. And I think you already said you certainly have. I'm glad to talk with anyone who wants to learn more. I can connect in with anyone local can certainly do that. But the Magnet organization itself, I think if you need to go to a facility to kind of see and feel what it looks and feels like, difference of the environment that you're in, and looking at their data. There's also certainly the ANCC, the American Nursing Credentialing Corporation, is the overarching organization that manages the Magnet work. To look on their website, there's a robust amount of information there. We didn't have time today to talk about all the proven metrics and even how Magnet started how many years ago, 25, 30 years ago, actually in Texas, when a group of researchers said, what's different about these hospitals in Texas, where they have good quality metrics at that time. They aren't losing nurses. What's going on? And so there was several years of scientific work that went on in research, and they came up with certain criteria, the metric that they saw, and that's what built out what the Magnet organization is. And so you can go in and certainly read and see all that, and you can see then the 25, 30 years of proven excellence and the indicators there that show in the data that show what that looks like. But that is all on the ancc.org site to learn more about that, and or reaching out to a local place wherever you may be. There's a few Magnet hospitals besides Emory, obviously, in the state of Georgia and beyond. So glad to connect anyone in with any of those things if they need more details.
Great, thanks. Bruce, do you have any other questions?
Oh yeah, we've got several, and that was really interesting. Thanks so much for explaining that process and how to get involved, how to get started, and the benefits. That was great. Okay, how does either Baldrige or Magnet incorporate advocacy for physician-centered wellness, or burnout, or stigma for physicians who seek mental health support?
Do you want me to start? I hate to take
Sure.
panelists. If someone else wants to take it, feel
Yeah, look, I'm happy to jump in. So Baldrige is very clear in the healthcare framework. The physicians are part of your workforce. And so as we look at our systematic approach to our workforce, which is all in category 5 in the Baldrige criteria, the physicians have to absolutely be part of that. It is required for the framework, but more importantly, it's the right thing. And so every segment of the workforce, and at Paulding, we have our volunteers, we have our employees, and our physician partners are all part of our workforce, and they all have special and unique needs in order to address resiliency and reduce burnout. And so as you create these systematic approaches to how you manage your workforce, you have to take into account the various segments of your workforce and ensure that you're meeting their needs. And so it's not a one size fits all within the framework. It's how are you listening to each of those segments and adapting to them. So physicians are absolutely a critical part of any Baldrige organization.
Ditto. And so as you look at those, like those 5 main components of like the Magnet model that Rebecca has showed us, that is about everyone who works is here that has to have that same feeling of inclusion and having their needs met. And so when I said our people first, that includes certainly our physicians on that team. When we say, how do we meet the needs of the people that are delivering the care? And so our physicians are just as important and equal in that work, and that Magnet certainly looks at. And so that is, and so I apologize if I did not bring that out, because that is not just about nursing or just about administrators. It is that whole care team delivery piece that we have to focus on in a very succinct, focused way to meet the needs of our people, whether it's mental health needs or wellness, workforce resources that people need to be able to function at the highest level they can, and they're here for a reason, and to be able to meet their mission of why they went into medicine or nursing to start with.
It may not answer the question directly, but when we're doing assessments, I mean, we see in hospitals, we see the physicians as a key segment of service to the within that organization, and it can be a gap if it's not done well. I mean, we're going to be looking for those measurements and those surveys and the focus groups or whatever process you have to engage the physicians and making sure that their needs are being addressed. It's like every other major group. As far as the patients are concerned, the physicians, even though they may be contract, or they may be on staff, or they may be even outside, they don't differentiate. They just see that physician as a member of that service system, and they will obviously give you feedback if that's not working well. So organizations own that. We don't let hospitals take a pass and say, well, that's not important to us. That is critical to the success, just like the nurses are, just like all the auxiliary staff are to the success of an organization. And in a hospital, that's critical.
Great. I have another question here for Dina. What is the biggest challenge of the magnet journey in the ambulatory environment? And what are some key differentiators or challenges the ambulatory setting poses?
How long do we have? So all kidding aside, as we put our document April 1st, so it's there, and it's a labor of love because, and I totally understand it. I grew up as a nurse on the inpatient unit, worked 18 years inpatient, and that's where the whole focus, right, of healthcare has really been in hospitals, and the ANCC Corporation, certainly that's where it started and focused as the care of the patients. We're looking from a healthcare, national healthcare system, right? So we look at population health and how we should be looking at the whole care continuum of patient care, not just acute episodic care. That is the framework for how we're working. ANCC, like all our payers, everyone, is saying, how do we readjust? How do we look at the metrics? How do we look at the ways that we're measuring success by these things that may not only be an acute episodic care measurement? And so that has been the biggest challenge, I'll say, as working with ANCC. It's been great. It's fun to be inaugural. It's also can be a lot to be inaugural because you got to be the pioneer and build things. To say, like, what are the nurse sensitive indicators? A very concrete example. When we look in the inpatient units, we were measuring things that nurses touch, like collapses or urinary tract infections, those types of things that may not always equate in the outpatient world as different nurse sensitive indicators that we measure in the outpatient world. And so how do we help our ANCC and others with those measurements to look at how do we know that we're practicing excellence? How do we show the metrics to look that way? They may not align. You can't really necessarily drop them into an inpatient model. And so that is some of the struggles or challenges that we've had for that. Everyone's on board. ANCC is like, oh my gosh, we are down this path with you. This is the way we have to look at care across the continuum. And it's just how do we work together then to build that? I talked about the teamwork. To look at that, look at the whole care team model and measuring RNs, MDs, MAs, everyone that's touching that patient. How do we measure that as well? And so looking at that too has been a nuance and that has not been looked at necessarily before in the magnet application and documentation piece. So those are some real meaty pieces, but those are things that we've been dealing with and figuring out as we march towards that excellence in a new environment, truly, and how we measure care outside of the four walls of a hospital per se.
Great, thanks, Dina. And I'll give everyone a 5-minute warning before we go back to Trent. I have another question for you. Have you been able to, and this is for the panel, have you been able to objectively track organizational impact via clinical metrics, financial ROI, et cetera, from your Baldrige or magnet journeys?
So category 7 in the Baldrige criteria is all about measurement, and it's actually the longest section and it's the highest point section. or category. And so, yes, we absolutely can. And, you know, one of the things that I'm proud of and passionate about is all around quality and patient safety. And we can objectively point to at Paulding being one of the best in the country. I mean, we were named to the world's best hospital list. We were named to number 19 ranked hospital in the country with the Loans Institute that came out this year. Certainly leapfrog and all those things. And not that it's about those awards, just like the Baldrige Award, quite frankly, isn't about it, but they're objective ways of measuring that we make an impact. And so you'll hear at Paulding, the team's very proud because we lead the organization almost across the board in patient experience, in team member engagement, in quality, in safety. And we are financially one of the more profitable, we're the most profitable hospital from a percent standpoint in the organization. And so when you are doing the right thing and you bring that together, you can objectively measure the effectiveness of it.
And likewise, I mean, it's those quality metrics that have financial implications that we can tie directly to those things. And I mentioned them just a minute ago, those nurse sensitive indicators like nosocomial infections, or wound care, those kinds of things that you link directly to nursing presence and nursing outcomes that lower the financial impact, improve patient outcomes all the way around. And so there is a direct correlation with that, as well as the workforce. When you look at the lower turnover rates, higher retention rates, less cost of care, those types of things that all have those metrics there that we measure by and are able to make the investment. Again, as I said, it's a board imperative that we become Magnet designated. There has to be a reason for that, right? So there's the outcomes, both patient outcomes and the financial savings that we receive from that. And somebody put in the chat, and it's the gold standard. Absolutely. It's the gold standard that you also, people want to come work in a place that's designated and has a high excellence for that.
And let me just add, if you're a Sterling or a Baldrige role model, you are going to have measures in every area, starting with your processes and all those things, and your customers, your employees, your leadership, and your financial and market share that show comparatives, that show best in class, that show where do you rate. I mean, we're not looking if you're a role model organization, you're going to be a very high rated organization whether it's top decile, whether it's best in class. I know we just had one of our role models this year, and they were in top decile with several of their outcomes in 7-1. I mean, that's what you're looking for. You're looking for that kind of standard of excellence that you're able to see evidence of in 7. You know, your processes create those results, and you can do great things, but we want to make sure that we have evidence. Not only are you getting good results, but how do you compare? And who are the benchmarks and best in class measures that you hold yourself up against? And if you're a role model, you have that information, and you are doing that well.
Great, thanks, Rebecca. We'll have to wrap it up. We've got about a minute before we send it over to Trent. Do you have any closing comments here of the panels?
Well, first, I again want to thank each of you for participating and giving us your insight into both programs. I think it's invaluable really for individuals to begin to create those connections, to know who they can reach out to when they have additional questions or concerns about beginning the journey. And I think that has been a wonderful effect of having a program like this. And I appreciate Trent and Bruce's support in being able to get this out to people so that they know they can reach out to any of you and ask the questions. I certainly include myself in that. If you've got additional questions, you can obviously hear the passion in every one of their voices, and hopefully my own as well. If we can help you on this journey, we are all happy to do so, but many thanks to the panel.
All right. Well, Rebecca, thank you so much for leading the charge today, and certainly an inspiring discussion. Certainly, yes, John, we did hear the word culture a few times, but really amazing work. Congratulations to your organization, John, and certainly the cultural transformation that you helped to lead. Just impressive to see it all come together. And to your point, every pillar of excellence touched in that journey. So congratulations, and thank you again to our panelists. Thank you also to those folks that were involved on our committee, our programs committee, to help set up today's event. Certainly Victoria Dunchari, Marion Spears-Carr and Angela Henry leading the effort. Thank you so much for putting on a great session today. Thanks again to our sponsors. We don't have the chance to do events like this and come together like this. We don't have sponsors who are willing to support our efforts. So thank you so much to all those out there that's helped to support this effort. And then thanks to ACHE. They have allowed us to put face-to-face educational opportunities out like this for our membership to really take advantage of. And certainly you can see by the attendance, it was really well appreciated. Again, we'd love your feedback. We always love to get feedback from you following events like this, where we can improve. I mean, obviously, we know that most of the feedback has been really positive this year around our face-to-face efforts, but we know that also we have ways to improve. So if there's anything you see that we can do better, we want to do that. So please fill out your evaluation form and let us know how we're doing. So with that said, again, thank you from GAHE to all our membership and others who attended today, and look forward to seeing you at one of our next sessions. And I will turn the mic back over to Ricardo Rivera to wrap up with some specifics around ACHE closing announcements.
Thank you, Trent. On behalf of ACHE, I want to thank our chapter leaders that planned today's session, the moderator and panelists, and all of you for your participation. Please complete the evaluation, which is open for 1 week. The direct link is in the chat box. You can also access the evaluation by visiting your My ACHE page and selecting My Online Learning from the Helpful Links section on the right side of the screen. From there, click on the Access My Courses link and you'll be directed to our learning management system where you can complete the evaluation. In the same location, you will be able to access the recording of this session within approximately 2 business days. Everyone who has attended today's session in its entirety will see their 1.5 hours of face-to-face credit posted to their My ACHE account within 2 weeks of this session in the My Education Credit section. That concludes our session. Today's program is copyrighted in 2021 by the American College of Healthcare Executives. All rights reserved. Thank you for attending and be well, everyone.
Thanks, everyone.